Let's continue our discussion on visual diagnosis inspection. So still on body movements, today we discuss about deviation of the eyes and mouth, facial paralysis as in Bell's palsy, and facial tic. Deviation of eyes and mouth. Deviation of eyes and mouth consists in the mouth being pulled towards the healthy side and an inability to close or open the eye completely. In addition, the patient finds it difficult to grimace, to bulge the cheeks, and grin and whistle. For its clinical significance, deviation of eyes and mouth is a consequence of wind stroke and is usually seen in middle-aged or elderly people. It always indicates internal wind affecting the muscles of the face. When deviation of eyes and mouth follows a stroke, it is called central facial paralysis in Western medicine, as it arises from the central nervous system. In facial paralysis following windstroke, the nerves above the eyes are not affected. That is, the movement of the eyebrows and the firing of the forehead are normal. By contrast, in peripheral facial paralysis, as in Bell's palsy, the patient will be unable to raise the eyebrow or furrow the forehead on the paralyzed side. Figure 4.1 will show the deviation of the eyes and mouth. So in full condition, in liver wind, deviation of eye and mouth, there will be tremors, severe dizziness, there's tinnitus, headache, numbness of limbs, tics, stiff, deviated or moving tongue, or wiry pulse. This corresponds to wind stroke. In acupuncture, we use liver 3, Gibber 20, Do 16, SI 3, bladder 62, Do 19, LI 4, plus local points for facial paralysis. If there is external invasion of wind cold in the channels of the face, this will manifest with the following symptoms: sudden deviation of mouth and eye, incomplete closure of the eye, inability to raise eyebrow. This corresponds to facial paralysis or Bell's palsy, and it is due to an invasion of wind cold, not in the lungs defensive chi portion, as in a common cold and influenza, but in the channels of the face. In acupuncture, we use the points LI4, lung 7, triple warmer 5, plus local points for facial paralysis. In liver wind and phlegm, this will manifest with deviation of eye and mouth, hypertension, tremors, severe dizziness, tinnitus, headache, numbness of the limbs, tics, a feeling of oppression of the chest, expectoration of sputum, deviated or stiff and swollen tongue with a sticky coating, wiry, slippery pulse. This condition is more common in old people. If there is liver chi stagnation, it will manifest with intermittent deviation of eye and mouth, depending on emotional moods. There will also be hypochondrial or epigastric distension, irritability, moodiness, a feeling of lump in the throat, premenstrual tension, and a wiry pulse. If there is deficiency of chi and blood, there will be slight deviation of eye and mouth, poor appetite, loose stools, weak voice, tiredness, blurred vision, dizziness, numbness or tingling of limbs, palpitations, dull pale complexion, pale tongue, and a weak or choppy pulse. In toxic heat in the channels of the face, this will manifest with deviation of mouth only, thirst, a bitter taste, swelling and pain of the face, toothache, headache, red eyes, red tongue with red points, with thick, sticky yellow coating. The pulse will be overflowing, slippery, and rapid. So now let's talk about facial paralysis in Bell's palsy. Facial paralysis is due to an injury of the peripheral nerves, while deviation of eyes and mouth following a stroke is due to the central nervous system. From a Chinese perspective, facial paralysis is due to an invasion of external wind, while deviation of the eyes and mouth following a stroke is due to internal wind. Facial paralysis is characterized by deviation of the mouth, incomplete closure of one eye, and inability to grimace, grin, bulge the cheek, whistle, or raise the eyebrow and furrow the forehead on the affected side, as shown on figure 4.2. Okay. Facial paralysis differs from the deviation of the eye and mouth in that in facial paralysis, there is also uneven furrowing of the forehead, while in deviation of the eye and mouth, there are no symptoms above the eyes. Like in this figure showing a person with Bell's palsy. As for its clinical significance, facial paralysis is due to invasion of external wind in the muscles of the face and primarily in the bright yang channels. In full condition, it can be due to external invasion of wind cold in the channels of the face. This will manifest with facial paralysis with sudden onset, incomplete closure of the eye, inability to raise eyebrow. This corresponds to facial paralysis in Bell's palsy, and it is due to an invasion of wind cold, not in the lungs' defensive cheek portion as in common cold and influenza, but in the channels of the face. In acupuncture, we use the points Li4, lung 7, triple burn of 5, plus local points for facial paralysis. Now let's discuss about facial tic. Tic consists of an involuntary twitching of the face muscles. In Chinese medicine, the facial tic may be due to various patterns, among which are liver qi stagnation, liver blood deficiency, liver wind with phlegm, and external wind. When due to liver qi stagnation, facial tic will be accompanied by irritability, depression, tendency to crying, abdominal distension, headache, and a wiry pulse. Liver blood deficiency causes facial paralysis by failing to nourish the muscles of the face and giving rise to empty wind. Other symptoms may include dizziness, a blurred vision, dull pale complexion, and a choppy pulse. Liver wind may lead to facial tic because it is in the nature of internal wind to cause involuntary movements. Facial tic caused by liver wind is more common in the elderly and is accompanied by vertigo, headache, loss of balance, and a wiry pulse. In the elderly, liver wind frequently combines with phlegm, both of which may lead to facial tic. Other symptoms include vertigo, nausea, headache, a feeling of oppression of the chest, a tendency to being overweight, a swollen tongue, and a wiry, slippery pulse. External wind may cause a temporary facial tic. In full pattern liver wind, it will manifest with severe eye tic, tremors, severe dizziness, tinnitus, headache, numbness of limbs, tics, stiff, deviated, or moving tongue, and a wiry pulse. In acupuncture, we use liver 3, gallbladder 20, do 16, SI3 with bladder 62, do 19, and LI4. In empty and full pattern, as in liver blood deficiency leading to liver wind, there will be occasional facial tic, slight tremor of the head and or hand, a facial tic, dizziness, blurred vision, unilateral numbness, and or tingling of a limb, pale and thin tongue, a choppy or fine and slightly wiry pulse. In acupuncture, we use liver 8, stomach 36, spleen 6, ren 4, liver 3, gallbladder 20, do 16, and li 4. In liver wind with phlegm, there will be facial tic, severe dizziness, blurred vision, tremors, numbness or tingling of the limbs, tinnitus, nausea, sputum in the throat, a feeling of oppression of the chest, stiff or deviated and swollen tongue, wiry, slippery pulse. This condition is more common in old people. In liver qi stagnation, there will be eye tic, hypochondrial or epigastric distension, irritability, moodiness, a feeling of lump in the throat, premenstrual tension in a wiry pulse. In external invasion of wind cold in the channels of the face, there will be short-lasting tic with sudden onset, stiff neck, occipital headache, and a floating tight pulse. So to summarize, in facial tic, if it's due to liver qi stagnation, there will be irritability, depression, and a wiry pulse. If it's due to liver blood deficiency, there will be dizziness, blurred vision, and a choppy pulse. If it is caused by liver wind, there will be vertigo and a wiry pulse. If it is caused by liver wind with phlegm, there will be vertigo, nausea, and a wiry, slippery pulse. If it is caused by external wind, there will be temporary tic. Thank you for your attention.